CFBTI is becoming a reference for R&D results of biotechnology and forest plant breeding in Indonesia. CFBTI is also undergoing a development and the downstream of R&D result, such as seed orchard development, DLSM, and private sector. Distribution of superior seed from breeding and development result and build-deployed research result, as well as the commercialization of R&D result with the private companies. With all the efforts we have done maximally, with the support from various sides, especially the related ministries that support CFBTI, it will be the center of science and technology excellence in forest biotechnology sector, forest plant breeding, and the conservation of forest plant genetic research.
Good morning, ladies and gentlemen. The opening program will commence shortly. Please let me read the Code of Conduct of 6 INAFOR 2021 Stream 5. Participants should dress properly during the seminar. Participants are required to identify themselves in the following format: name of institution _ participant full name. During all session, participants should turn off the microphone. However, if they have questions or comments, the moderators will allow them to turn it on. Please fill out the attendance list. During the session, a link to the attendance list will be provided. The e-certificate will be generated by the committee using this attendance list. The participants are welcome to raise a question or express their opinion during the session by using the raise hand feature or through the chat box in the Zoom platform. Please identify yourself as well as the speakers or presenters to whom your question or opinion are directed. The note taker will compile the question or opinions, and the moderator will choose which one will be addressed by speakers or presenter. Moderator will have complete control over the session they are in charge of. Participants will receive an e-certificate within 6 days of the seminar based on the attendance list. The seminar will be recorded and will be available publicly on the 𝒕𝒂𝒏𝒔𝒈 YouTube channel. The participants are not permitted to record the presentation. For selected participants, the organizer will present a variety of gift prize. The winner will be selected by a random drawing and announced at the end of every session. So please stay with us until the end of the seminar. Gentlemen, we would like to request you to kindly turn off your microphone as the opening program will commence shortly. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, good morning, ladies and gentlemen. Honorable Director of Center for Forest Biotechnology and Tree Improvement, Honorable Acting Director of Center for 𝒕𝒓𝒂𝒏𝒔𝒕 Forest Ecosystem Research and Development, Honorable Professor Agung Indro Nugroho, Dean of the Faculty of Pharmacy, Gadjah Mada University, Honorable Keynote Speakers, Professor Ali Gufron Mukti, Professor of Public Health and President Director of National Health Insurance, Professor Zulis Ikawati from Faculty of Pharmacy, Gadjah Mada University, Dr. 𝒕𝒓𝒂𝒏𝒔𝒕, Director of Indonesian Spice and Medical Crops Research Institute of Ministry of Agriculture, Dr. Robert Nasi, Director General of Center for International Forest Research, Honorable invited speakers, respectable guests, speakers, moderators, and all participants. Welcome to INAFOR 6 International Conference on Greener Future, Environment, Disaster Resilience, and Climate Change on Stream 5 with the title Cutting COVID-19 Transmission, Handling Health, and Economic Impact. Ladies and gentlemen, my name is Istiana. It is my pleasure to be the host of today's conference. On behalf of the organizing committee, I would like to extend warm welcome to all of you. We really appreciate that you taking your time to join us today, and we hope that this seminar will be fruitful and engaging, and you will stay with us until the end of the conference. Before we start the opening ceremony, I would like to overview the sequence of the programs of today's conference. The opening ceremony will begin with National Anthem of the Republic of Indonesia. This will be followed by opening remark delivered by the Director of Center for Forest Biotechnology and Tree Improvement. The first program after the opening ceremony is the keynote speakers that will be chaired by Professor Agung Indro Nugroho. We will have a 30-minute break starting at 12 o'clock before commencing the second program. In this program, we will have a photo session, certificate and gift presentation to keynote speakers, and announcement of giveaway prize for participants, and also video exhibition. The second program is session 1 presentation with 3 invited speakers. This session will be chaired by Professor Budi Laksono. This program will be followed by a very short break for photo session, certificate presentation to the invited speakers, and giveaway prize for the participant announcement. The third program is session 2 presentation with 5 speakers. This session will be chaired by Professor Rina Laksmi Hendrati. Before closing the seminar, a summary will be delivered by the Coordinator of Scientific Committee, Professor Liliana Baskorawati. And to formally close the program, a closing remark will be delivered by the Organizing Committee Coordinator, Ibu Retisa Mutiara Devi. At last, at the very end, we will have award presentation for the best presenter, and also sponsorship appreciation and announcement of giveaway prize for participants. Ladies and gentlemen, now we will sing Indonesia National Anthem, Indonesia Raya. We would like to request you to raise. Please be seated. Thank you. And now, for formally open this event, an opening remark will be delivered by the Director of Center for Forest Biotechnology and Tree Improvement. Ladies and gentlemen, please welcome Bapak Dr. Nur Sumedi. Bapak Dr. Nur Sumedi, the stage is yours now.
Thank you. Distinguished guests, Professor Dr. Ali Hufran Mukti, MSc, PhD, Public Health Professor, President Director of National Health Insurance, Professor Dr. Agung Indro Nugroho, SSI, MSc, APT, the Dean of the Faculty of Pharmacy Gadjah Mada University, Professor Dr. Julis Ekawati, APT, the Faculty of Pharmacy Gadjah Mada University, Dr. Insinyur 𝒕𝒓𝒂𝒏𝒔𝒕 Iriani, MSc, from Ministry of Agriculture, and Dr. Robert Nasi, Director General CIFOR. Honorable guests, participants, my colleagues, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Good morning to all of you. Let us express our most gratitude to the gods, the Almighty, for allowing us attending this special event of the 6th International Conference of Indonesia Forestry Researchers, INAFOR 2021. Greener Future, Environment, Disaster Resilience, and Climate Change, especially on Stream 5, Cutting COVID-19 Transmission, Handling Health and Economic Impact in Good Healthy. Today, September 8th, 2021. Honorable guests, participants, ladies and gentlemen. INAFOR has been conducted every 2 years since 2011. This year's 2021 is the 6th INAFOR, which is being convened by the Agency for Standardization of Environmental and Forestry Instrument, or 𝒕𝒂𝒏𝒔𝒕, formerly known as Research and Development and Innovation Agency, or FORDA. This could be the last event of INAFOR being held by 𝒕𝒂𝒏𝒔𝒕 under the Ministry of Environment and Forestry. The next INAFOR may be convened by the National Research and Innovation Agency, or BRIN, as an autonomous agency in a position to support Indonesia's national development programs through research, outcome, and innovations. The 6th INAFOR 2021 is today's event, scheduled from 7 and 8 September 2021. Due to COVID-19 pandemic, the 6th INAFOR 2021 for the first time is being conducted online, where the entire conference is taking place on a digital platform. In spite of that, we are still very keen to welcome you to this conference. On behalf of the organizing committee, I would like to express our appreciation to all distinguished guest speakers, presenters, and participants from overseas and or from Indonesia for attending this event. We hope you stay safe and healthy during this pandemic situation. Thank you for participating in the 6th INAFOR 2021 Stream 5. This conference is intended to provide a forum for forestry scientists, including government, university, and private sectors, both from Indonesia and worldwide, for exchanging views, present their latest findings, discuss similar topic of interest, and develop a network. The main objective of the 6th INAFOR 2021 Stream 5 is to explore the impact on the potential of environmental and forest resources to handle COVID-19 pandemic through sharing, discussing across researchers, scientists, and other relevant stakeholders from international perspective. Accordingly, the theme of this conference is Cutting COVID-19 Transmission, Handling Health, and Economic Impact. Honorable guests, ladies and gentlemen, the coronavirus disease 2019 or COVID-19 pandemic is the ongoing worldwide pandemic caused by severe acute respiratory syndrome, coronavirus 2, or SARS-CoV-2. This virus have spread across the world and declared as an international public health emergency by World Health Organization. The global outbreak of COVID-19 is affecting every part of human lives, including the economic development, social activities, environment, and forestry. Positive and negative impact have also emerged due to this pandemic, especially on the environment and forestry. In relation to ecological and forestry sector, several biological resources and biodiversity from forests have been used for herbal medicine to treat disease caused by coronavirus. These potential resources might increase the community's economic by promoting small industries. The COVID-19 pandemic has many negative consequences. It has severely affected the global economy, social and environment, including forest-dependent communities, forest restoration, and forest community resilience. On the contrary, there are significant improved ecosystem which may assist with the ecotourism based on technology and innovation of forest ecological system. In this conference, we are trying to find solution and developing outline of various possible ways of cutting down the COVID-19 transmission, treating the disease, and achieving long-term forest environmental benefit in order to increase the global economy. Honorable guys, ladies and gentlemen, today we are very fortunate to have such esteemed professionals speaking at our conference. We should be grateful for having brought together such a wealth of knowledge and talent, have wide appeal to both health and safety professional and business, who will give us more insight into the topic of this conference. Today we have Professor Dr. Ali Ghufran Mukti, MSc PhD, who will present research and innovation in the COVID-19 pandemic era. Then Professor Dr. Julis Ekawati APT, who will present the process of drug discovery from forest resources. We will have a deeper insight about the potential of spices, medicinal and aromatic plants to help overcoming the COVID-19 from Dr. Insinyur Evi Savitri Iriani, MSc. Then we also have Dr. Robert Nasi, Director General CIFOR, who will talk about the economic impact of the COVID pandemic. And the last, we are also very grateful to have Professor Dr. Agung Indro Nugroho, SSc MSc APT, the Dean of the Faculty of Pharmacy, Gadjah Mada University, who are keen to join this event and provide support by becoming our moderator in this first session. Thank you very much. And this morning, we are also welcoming approximately 300 participants, including forestry researchers, scientists, students, lecturers, foresters, forestry practitioners from private and government, NGOs, and other research and development institutions related to forestry. My fellow participants, ladies and gentlemen, we truly understand that in order to provide the best possible solution to this COVID-19 pandemic problems, we cannot work alone. We need strong multi-sectoral collaboration between various stakeholders across multidiscipline. By attending this meeting, we hope that our finding could be disseminated and communicated widely. However, to solve the problem, it needs a process. And through the process, people bring all their personal experience and expertise to the table for a discussion. Therefore, it will be an assurance to create a collaborative and synergized research in the future. We would like to express our sincere appreciation to APP Sinarmas for continuously providing great support to this event. I would also like to thank to the organizing committee as well as the scientific committee who worked tirelessly to make today a reality. Lastly, I ensure you have very fruitful and rewarding exchange today. We wish you every success with this important conference, and we look forward to learning about the outcome. May God bless us all. Thank you. Billahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Bapak Nur Sumedi, for opening this program. And ladies and gentlemen, now we are in the first program that we are excitedly wait for. Professor Dr. Agung Indro Nugroho will lead this session. Professor Agung Indro Nugroho is the Dean of the Faculty of Pharmacy, Gadjah Mada University. Good morning, Prof. Good morning, Prof. Agung.
Good morning, ladies and gentlemen.
Professor Agung Indro Nugroho, he obtained his PhD in the field of molecular pharmacology from School of Medicine, Ehime University, Japan. He is a lecturer of pharmacology laboratory, pharmacology, and clinical pharmacy. Professor Agung Indro Nugroho, the screen is yours now. Professor
Okay,
Agung,
can we?
Yeah.
Yeah. Okay. Can we start?
Yes, please. Yes, please.
Okay. Okay. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Your Excellency, Bapak Dr. Agus Justianto, Director General of the Forestry Research, Development and Innovation Agency, Ministry of the Environment and Forestry, Republic of Indonesia. Your Excellency, Bapak Dr. Nur Sumedi, Director of Center for Forest Biotechnology and Tree Improvement Research and Development. Your Excellency, Board of Executive, Researchers, Staff of Center for Forest Biotechnology and Tree Improvement Research and Development. Distinguished guests, invited speakers, and all participants. Welcome to the 6th International Conference of Indonesia Forestry Researcher INAFOR 2021 Stream 5 Tropical Forest and Environmental Research Conference. And I am Agung Indro Nugroho, your moderator for this session. The theme of international conference is Cutting COVID-19 Transmission, Handling Health and Economic Impacts. Ladies and gentlemen, coronavirus pandemic spread to Indonesia on March 2020. Then Indonesian government declared the coronavirus pandemic as a national disaster at this time. The pandemic spread to all provinces in Indonesia on April 2020. The COVID-19 pandemic has affected several national sectors, for example, health, education, economy, and agriculture. The Indonesian government has taken a policy to cut the spread of COVID-19 pandemic. The three main policies are restrictions, social and physical distancing, implementation of health protocols, and also vaccination programs. The Indonesian government also supports research institutions and universities to carry out innovations and research to overcome the COVID-19 pandemic. In order to preventing, to do education and direct handling. Research efforts related to prevention are the development of immunomodulatory herbs and vaccine development. Educational efforts including fighting hoax, education to deal with pandemics, education on drug use, etc. Ladies and gentlemen, on this occasion, we are going to listen the presentation of 4 keynote speakers that are related to effort to deal with COVID-19 pandemic. We have our keynote speakers with us. The first, Professor Dr. 𝐈𝐍𝐀𝐅𝐕𝐈 PhD. He is the President Director of BPJS Kesehatan, the Social Security Administrator for Health. He is also a lecturer, professor at the Faculty of Medicine, Public Health and Nursing Universitas Gadjah Mada. He is going to speak about research and innovation in COVID-19 pandemic era. Second speaker is Dr. Engineer Evi Savitri Iriani. She is Director of Indonesian Space and Medical Crops Research Institute, Ministry of Agriculture. Then, the next speaker is Professor Dr. 𝒊𝒑𝒂𝒏𝒔𝒕𝒉 pharmacist from Faculty of Pharmacy, Universitas Gadjah Mada, Yogyakarta, Indonesia. She is going to give a lecture with a topic of the process of drug discovery from forest resources. And the last speaker, Dr. 𝒕𝒂𝒏𝒔𝒆, Director General CIFOR. He is going to speak about the economic impact of the COVID-19 pandemic. And please welcome our speakers. And in general, ladies and gentlemen, the lecture will take about 30 minutes each, and after that we will have discussion for about 10 minutes. Especially from the first speaker, later after finishing the presentation, after presentation of Professor Ali Gufron, because he have another appointment, I will open a Q&A session for 10 minutes and then continue to the next speaker. For introduction, I would like to, read the short biography of Professor Ali Gufron. Yeah, Professor Dr. Ali Gufron, MSc, PhD. Educational background, he got PhD degree from Faculty of Medicine, University of Newcastle, Australia in 2000, and also he got professional health insurance expert from 𝒕𝒂𝒏𝒔𝒕 in 2002. About his career, ladies and gentlemen, he is now President Director of National Health Insurance from February 2021 until now, and he also was Deputy Minister of Health of Republic of Indonesia and also Dean of Faculty of Medicine, Universitas Gadjah Mada in 2008. About achievement, in 2017, from Coventry University, United Kingdom, he got honoris causa in health sciences. He also got award of a certificate of recognition by World Health Organization, WHO, a reward for his contribution and commitment on global health workforce alliance for the agenda WHO Health. Ladies and gentlemen, please welcome our keynote speakers, Professor Dr. Ali Gufron Mukti, PhD. He is going to speak about research and innovation in the COVID-19 pandemic era. Time for presentation is maximum 30 minutes. Time is yours, Professor Ali Gufron. Thank you very much. Okay, Professor Ali Gufron, is there any trouble in your connection? Professor Ali Gufron?
Prof. Agung?
Are you ready? Yeah, okay.
Professor Ali Gufron still on his agenda and his other agenda. He will be ready soon.
Okay.
So could you please introduce other keynote speakers, please?
Okay, thank you very much, Bu Ida. Okay, thank you very much. While we are waiting for Professor Dr. Ali Gufron, I would like to mention short biography of our speakers, yeah, Professor 𝒊𝒑𝒂𝒏𝒔𝒕, Dr. Engineer 𝒕𝒓𝒂𝒏𝒔𝒕, and also Dr. 𝒕𝒂𝒏𝒔𝒕. Yeah, let me mention curriculum vitae of Dr. Engineer 𝒕𝒓𝒂𝒏𝒔𝒕. About education background, Dr. 𝒕𝒓𝒂𝒏𝒔𝒕, she got doctoral degree from Agro-Industrial Technology, IPB University from 2008 until 2013, and she got master degree from same university, IPB University, from 2000 until 2004, and she got a bachelor degree from same university, IPB University, from 1986 until 1991. About her career, now Dr. 𝒕𝒓𝒂𝒏𝒔𝒕 is director of ISM CRI from September 2019 until now. She was also a deputy director for collaboration and dissemination of 𝐼𝐍𝒂𝒂 from June 2016 until September 2019. About her achievement, ladies and gentlemen, she is one of the 104 Indonesian Most Prospective Innovations Award Outstanding Researcher at MOA. Third speaker, ladies and gentlemen, Professor Dr. 𝒊𝒑𝒂𝒏𝒔𝒈 pharmacist. About educational background, she got PhD degree from School of Medicine, Ehime University, Japan. Bachelor degree she got from Faculty of Pharmacy, Universitas Gadjah Mada, from 1987 until 1982. 1990, yeah, okay. And newest scientific publication, the effectiveness of a smartphone application based education teman diabetes on clinical outcomes of type 2 diabetes mellitus patient, July 2021, and plant natural products for cognitive impairment, a review of the preclinical evidence, publication on Journal of Applied Pharmaceutical Science, June 2021. And about recent research, she is doing INAFOR clinical tests, herbal immunomodulators to support COVID-19 therapy. Downstreaming of hesperidine diosmin-based product for COVID-19 prophylaxis and therapy in 2020. Immunomodulator candidates from Indonesian herbal products in handling COVID-19 in the same time, 2020. And development of sapan wood bark, 𝐾𝐴 as a herbal medicine for cognitive enhancer from 2019 until present. And the last speaker, curriculum vitae, Dr. Robert Nasi. Educational background, he got PhD in the field of ecology from the University of Paris-Sud-Orsay. And about his research, he is doing research about ecology and management of tropical forests. His particular research interests include the sustainable use of forest products and multiple use management of tropical forests. And also main disciplines are ecology, botany, biometrics, tropical forest management, and silviculture. And about scientific work, to integrate social and biological sciences for better management of tropical forests, more sustainable livelihoods, and better design forest policies. Yeah, it is, how to say, these are curriculum vitae of keynote speakers. I would like to ask Professor Dr. Ali Gufron. Are you ready, Professor Dr. Ali Gufron, to present your presentation at this time?
Yes, thank you, Professor Agung.
Okay.
Can you hear my voice?
Yeah, sure. Okay. And okay. Time is yours, Professor Dr. Ali Gufron, and your time for presentation is maximum 30 minutes.
Okay. Thank you very much. Can you see my presentation?
Still not.
Can you see my presentation?
Still not. Yeah. Maybe waiting for a while because maybe need a process. Can you try again, Professor Dr. Ali Gufron, to share your slide?
Yes, thank you. Okay, I will try again.
Okay.
And sharing. Now it's okay. Can you see? Or not yet?
Yep. Okay. No, we can see your slide.
Okay.
Okay. Thank you very
much. First of all, I would like to thank for this very important opportunity and honorable the host, Bapak Djoko Suyanto, and Ibu Maharani Pamukti, also the team, as well as Professor Dr. Insinyur Budi Laksono, Honorable Professor Dr. Yulis Ekawati, Dr. Insinyur Evisa Fitri Iriani, and Dr. Robert Nasi. Of course, thank you very much, Professor Dr. Agung Indronugroho, for the moderator. Yeah, I was assigned to talk about research innovation in the era of COVID-19 pandemic. As you know, now I'm the President Director of BPJS Kesehatan, that is like National Health Insurance, and where the inside of the BPJS Kesehatan, we are developing innovation and research in order to increase the quality of care and quality of administration using Industrial Revolution 4.0. So therefore, I just talk about this and also the innovation, how to build the research innovation ecosystem in Indonesia, and how actually the pentahelix working together between important stakeholders in building research innovation ecosystem in Indonesia, especially in relation also with the handling health, transmission and economic impact, as well as disaster resilience and climate change. Ladies and gentlemen, for the BPJS Kesehatan, now the program is really big program with the membership already reached 222.4 million people. So in France, for example, as the big country, but the population may be less than 120 million, but we already, our membership is 222.4 million. So it is around 82% of the whole population of Indonesia. And unfortunately, if we see the utilization are always increasing, steadily increase, except in the year 2020 because of the COVID-19 pandemic. And here, there are many primary healthcare facilities, more than 23,000 contracted by BPJS Kesehatan, and around 44% public health centers and 24% private clinics, and more than 2,500 hospitals, and around 63% of the hospital contracted with BPJS are private. And we know that one of the BPJS Kesehatan responsibility to maintain financial sustainability of the JKN program and increasing the quality of care. Unfortunately, because of the COVID-19, then it is our challenge how actually our members will pay and how actually BPJS Kesehatan will be sustained. Because in the year 2019, BPJS has faced very difficult situation and we fail in paying to the hospitals, apothecs, and also primary healthcare centers. So therefore, now we are trying to make adjustment of the BPJS Kesehatan in relation to the COVID-19 pandemic. And of course, we are also now very happy because the satisfaction level as a measurement of the quality in the indicators is increasing. Now we achieve 81.5% of satisfaction, which is the sample respondent survey from total 3,722. This involves 13 branches and 26 branch offices, and also 51 regencies and cities. And also for satisfaction level in terms of providers, in this case health facilities, both in primary care and also in hospitals, we are happy because at least 4 out of 5 health providers, especially hospital, they are satisfied. So of course it is not easy. And how actually the impact of COVID-19 JKN program membership? Many have difficulties in paying the premium, and also the local government who paid for some people, especially those who are considered have difficulties and then covered by local government, they have difficulties in paying this payment because of the COVID-19 pandemic. And of course that the pandemic creates economic pressure, which cause, again, informal sector workers and non-workers reprioritize the spending on basic need. And therefore, if we see here the utilization of healthcare utilization, each year increasing utilization except in the year 2020 because of the pandemic. And we, in the era of pandemic, was assigned by the government to verify COVID-19 hospital claims, and huge number, and with debate because the new frontier and new innovation in the treatment, for example, like immunoglobulin, which is very expensive, as well as, for example, ivermectin, where still debate, and Prof. Julius, of course, do not agree, and many pharmacists do not agree. But we heard that India, to reduce the pandemic, especially in the second wave, they use they call it ivermectin. In fact, this drug ivermectin is actually designed for treating the helminths or parasites. And the BPJS Kesehatan also have a role to vaccinate. So we are developing 𝒕𝒂𝒏𝒔𝒕, the innovation and research on developing 𝒕𝒂𝒏𝒔𝒕, and now we have mobile 𝒕𝒂𝒏𝒔𝒕 special for vaccination. And it is again, as the new research and innovation. Until early September 2021, Indonesia have reached approximately 100 million doses of vaccine. And additionally, BPJS Kesehatan also cover post-vaccination adverse events. Ladies and gentlemen, how actually Indonesia innovation ecosystem pentahelix collaboration? So we should work together between academician, then government, media, community, and industry. So we have to, in the future, the direction is the research should be directed to the community problem-based research. And this should be, done by researchers, academicians, but utilized by industry. And we hope that the government have good policy and ease bureaucratic procedure. So in terms of doing research and innovation should be supported and easy to do it, and there should be enough incentive. And we hope that in the university, when graduates should be as the job creators. And of course that in media here, not only socialization, but also develop the constructive critique. When we are talking innovation index, so Indonesia, I think we have to work hard, because we still under Singapore, and that is the difference between Indonesia in terms of the component of institution, human capital, research, infrastructure, market sophistication. Compared to Malaysia, also we are still have left behind. So therefore we have to work very hard, especially in the knowledge technology output, also creativity of the output. So here that how actually the government commitment in accelerating development of pharmaceutical and medical devices in the research in the era of pandemic. So there are many regulations supported, and also presidential decree, economic policy, and also regulation, the Minister of Health, that concerning the action plan for the development of the pharmaceutical and medical devices industry, ensuring availability pharmaceutical preparation and medical devices, and also how actually the role of Minister of Education and Research, as well as the Agency of Research and Innovation, or BRIN. So we increase the competitiveness, because many forests, many we have plants which can be developed for pharmaceutical product. It is very important. So therefore, the acceleration of the production, independent and development is, again, it is very, very important. Ladies and gentlemen, so development of COVID-19 medicine and therapy, there are many things here. I will not, explain one by one, but we investigate quinine pills and mesenchymal stem cell, where now the stem cell, including the vaccine. But of course, there are many debate on this, but we developed the anti-serum and also plasma convalescent, in fact, ivermectin, and multi-center clinical trial, developing what we call it 𝒕𝒂𝒏𝒔𝒈. So multi-center clinical trial now is easily done in Indonesia, because we already developed what we call it 𝒕𝒂𝒏𝒔𝒈. And this automatically, if each centers send the protocols, and they can automatically doing the statistical analysis. That is really a good thing. And digital, digitalization and healthcare innovation in handling COVID, there are many, including, as I mentioned, multi-center clinical trial, with we call it 𝒕𝒂𝒏𝒔𝒈, and now developed, and we thank to God, because I'm also one of the innovators, and now we are still trying to process the patent. And we are also developing many vaccine. That is red, white vaccine, where we hope that in the early 2022 already produced, because now already a clinical trial. And I will not again explain one by one, because we have here domestic vaccine. So in terms of the vaccination in Indonesia, sorry, ladies and gentlemen, because the connection just a problem, but now it's okay. So okay, I continue, but yeah. Wait a minute, because now can you see my presentation? Because just disappeared.
Still not,
Now, can you see?
Mr. Gufron. Still not. Maybe still loading. Yeah, we are waiting for display. Yeah, maybe still process. Okay. No,
Okay.
yeah. No, we can see your slide.
Yeah. Okay. Oh, sorry. Now, can see it?
Okay.
Okay. So I continue. So again, we also in BPJS developing, not only we are doing also the management of information on vaccination by 𝒕𝒂𝒏, where 𝒕𝒂𝒏 working together with Peduli Lindungi by Ministry of Information, also with Minister of Health, but we also now developing new end-to-end digital administrative service. You can imagine before COVID-19 in branch office of BPJS, one room around 200 to 300 members or patients are, brought there. And, now after developing innovation, only with Pandawa, with mobile 𝐿𝐿, Chika, now only less than 10% in the office room in each branch, for example, like in Yogyakarta. So the role sorry, it's just because I was in the mountain now, so just cut the connection. So again, I will fast, listen fast. Yeah. Okay, while waiting for the presentation connection, so I will continue that actually, again, we have many new innovation, for example, to reduce the queue in BPJS Kesehatan, both in hospital or in, administrative office. And BPJS Kesehatan with Ministry of Health now piloting the teleconsultation service during the COVID-19 pandemic with connect chronic disease patient with specialists in hospital virtually through primary care doctors. And we combine system from BPJS and the Ministry of Health accommodate ultrasonography and tele-EKG. So we also have a teleconsultation, and it is very important. And of course, we hope that in the pandemic, the cases will be decreasing, and we will again live, with COVID-19 maybe in the future, and we hope this will be controlled. So again, now I conclude my presentation that pentahelix sorry again, just disconnect again. So we have, my conclusion is that with the pentahelix, we hope that qualified researchers and innovators will be developed, and the pentahelix ecosystem of research, we hope that we work together between academicians, the government, the media, the civil society, and also the industry. And there is, about the climate change. It was, predicted that Jakarta will be sunk, akan tenggelam, in maybe in the year 2020 something. And we hope this will not be occurred. And it is our challenge, and we have to work together how the climate change will be better, and we have good disaster resilience and have a good, better future environment. So therefore, during this COVID-19 pandemic era, we hope that we can control transmission. Sorry, this just cut again, just disconnect again. So I think I have to finish now. We hope that BPJS have contribution as the industry with research and innovation to increase quality of care and quality of services. That is all, Prof. Agung Indronugroho. Thank you very much. Thank you.
Okay. Thank you very much, Professor Dr. Ali Gufron Mukti, PhD, for your interesting presentation, I think. And now, ladies and gentlemen, Professor Ali Gufron already explained for us, the topic upon our insight about research and innovation in the COVID-19 pandemic era. Professor Ali Gufron also try to connect the topic with the policy of BPJS health insurance. Ladies and gentlemen, now I open a Q&A session for only 1 until 2 questions. If you have questions, please write in the chat column or raise hand. But better if you write in the chat column, and I would like to read to Professor Ali Gufron. Okay. Are there any questions?
Thank you, Prof. Agung.
Yeah. Are there any questions, ladies and gentlemen? Please write in chat column, or maybe you directly ask to Professor Ali Gufron. Yeah. If still not, I have one question, Professor Ali Gufron. It is very, interesting, your presentation about research and innovation, in the COVID-19 pandemic era. And now, you are director of BPJS, right? Yeah. And how to facilitate, and how to facilitate, the product of research, product of innovation in the COVID-19 pandemic era with BPJS health insurance, how to include the products of research and innovation in the COVID-19 pandemic era in BPJS. Can you explain this this question? Okay.
Yes, thank you very much. So yes, Prof. Agung, we have incentive to our BPJS Kesehatan employee.
Yeah, there is disconnection with Professor Ali Gufron.
Sorry, just disconnect again. Okay. This is the last one. So we are working together with university, and we have now publication of the journal, of our own journal. So the result of the innovation research can be sent to BPJS Kesehatan, because now we have, a journal of our own for publishing the innovation and research to increase the innovation, to increase the quality, efficiency, and effectivity. And again, now we are trusted by the International Social Security Association as the chief chair of the, we call it TC Health. So that is the technical core on commission on health. So therefore,
there is a disconnection again.
Sorry, this is the last one.
Okay.
That is because in the peak of the mountain.
Okay.
Thank you very much. Again, we are connecting with as the industry with innovation, and we have budget and many data. One day, every day, more than 700,000 data transaction conducted by BPJS. So welcome to researchers, innovators to work together to solve our problems. That is to stop COVID-19. This is all, and thank you very much. And I'm sorry because of the disconnection many times. Thank you.
Okay, thank you very much, Professor Ali Gufron Mukti, for your explanation. I think it is a good insight, for us, because last time I meet Professor Laksono Trisnantoro that Ministry of Health is supporting, researcher to do traditional medicines, especially phytopharmaca. So I think we also invite forest and environmental researcher to do research, to explore more forest and environmental, to make traditional product to be phytopharmaca, and maybe we can propose to BPJS to include this product in BPJS. Thank you very much, Professor Dr. Ali.
You're welcome. Thank you very much, Prof.
It is a very interesting presentation, and ladies and gentlemen, please give a big round of applause for Professor Dr. Ali Gufron Mukti before he leave this the conference. And
thank you.
Okay, the committee
give me permission to leave this conference.
Okay, Professor Ali Gufron Mukti, the committee will give certificate of appreciation, but soon we will send to you. Okay?
Okay. Thank you very much.
Okay, thank you very much, Professor Dr. Ali Gufron Mukti, for your interesting presentation. We can meet in the future, in the near future, in the same conference. Thank you very much again. Okay, ladies and gentlemen, now we continue to next keynote speakers. Other keynote speakers, the first, Dr. Engineer 𝒉𝒂𝒏𝒈, and then Professor Dr. Julis Ikawati, pharmacist, and the last one, Dr. Robert Nasi. Ladies and gentlemen, I already mentioned the short biography of our speakers. Now, time for its presentation is maximum 30 minutes, and for keynote speakers, time is yours. And firstly, for Dr. Engineer 𝒉𝒂𝒏𝒈.
Okay, thank you, Mr. Chairman.
Okay.
Have you seen my presentation?
Okay, we can see very clearly.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Honorable Director of Center for Forest Biotechnology and Tree Improvement, Research and Development, Honorable Professor Ali Gufron Mukti, Professor Julis Ikawati, Dr. Robert Nasi, and Professor Agung Hendro Nugroho. Distinguished participants, ladies and gentlemen, good morning. First, I want to thank to the committee for inviting me in this prestigious event. It is an honor for me, on behalf of 𝒊𝒈, to be present in this important meeting, which is attended by many distinguished guests, researchers, academicians, and also practitioners. I think it has been almost 2 years people around the world face the COVID-19 pandemic. Please, next slide. Including in Indonesia, this coronavirus pandemic is not only harmful to our health, but also cause an economic impact for many countries. To date, September 7, 2021, more than 220 million people worldwide infected by COVID-19, with the total deaths near to 4.6 million people. In Indonesia, the cases is more than 4 million, with the total deaths of more than 130,000 people. As we know that many countries have tried to find solutions to combat this pandemic. Fortunately, our country, Indonesia, has endowed with rich biodiversity, which has medicinal properties. Many of them are grown with wild in our forests. Thousands may be cultivated for traditional uses, and hundreds of species are cultivated for commercial and industrial purposes. Indonesia is the third largest country with mega biodiversity. There are more than 40,000 plant species, of which 10,000 are medicinal plants. The Ministry of Health, through the 𝒉𝒂𝒏𝒔𝒎𝒊𝒂𝒏 program, has succeeded in identifying more than 2,800 species of medicinal plants. Many publications regarding medicinal plants mention that there are some medicinal plants that have immunomodulatory properties which can help prevent COVID-19 infection or even help in speeding healing of anti-inflammatory, expectorant, decongestant, antiviral, or medication that can help reduce the symptoms of illness. In addition, many kinds of research on the biological activities of plants have been published, which are known to have antivirus function. So we have the opportunity to find antivirus drugs, even though it will take a long time. But I think we have to start because we don't know how long this pandemic will end. So we don't need to start from zero because we have all in our country. Distinguished guests, ladies and gentlemen, our biodiversity, non-medicinal properties, either empirically or scientifically proven, is the initial capital for us to help find solutions to overcome COVID-19. However, we cannot do that ourselves. We must collaborate with various institutions and researchers who have the competence in various fields to accelerate our research and produce the output faster, because we are racing against the time and even race with the coronavirus, which mutates so quickly to produce new and more infectious variants. Ladies and gentlemen, let us share our experience in herbal product from eucalyptus. We form a solid research supported by our DG of IARD. It consists of medicinal plants expert from Balitro, a phytochemist from the BB Pasca Panen, virologist from BB Veteriner, who formulate, develop, and testing the eucalyptus product. First, we try to select from several plants that, according to the literature, empirically have benefits as immunostimulant, antiviruses, and reduce symptoms often faced by the COVID-19 patient. There are approximately 50 plants that we are trying to explore for their potential. Of the 50 species, we group into two large groups. First, the plants that contain flavonoid and such as red ginger, and then orange, lime, curcuma, gambir, artemisia, sungkai, sengkubak, and many other species. And the second large group is plants that containing essential oil such as eucalyptus, citronella, lemongrass, and then Lecadendron, Clausenal, Leptospermum species. This is some example of extraction and distillation process of fresh ginger. And then we evaluate the antiviral activity of this species of these plants against corona model viruses such as influenza or H5N1, and also gamma coronavirus or IBV, using specific pathogen-free fertile chicken egg and ferocell. One of the potential is testing as antivirus is from the eucalyptus species, especially Globulus and Citriodora. Our studies showed that eucalyptus species compared to other species is more effective and the efficacy is higher than other plants. So in the next project, we are focusing in develop eucalyptus, especially from Cidriodora and globulus. Eucalyptus contain bioactive compound 1,8-cineol. Next, please. A monoterpene cyclic which widely distributed in plants and found in high concentration in the essential oil. Eucalyptus 1,8-cineol has been shown antiviral, antibacterial, antifungal, anti-candidal, insecticidal, and herbicidal activity. Moreover, eucalyptus oil has been reported to exhibit analgesic and anti-inflammatory effect during cold, flu, or sinus congestion, and also as antioxidant. Eucalyptus also can inhibit influenza viruses or H1N1 replication. In contrast to Eucalyptus globulus, with high content of 1,8-cineol, Eucalyptus cidriodora has the high content of citronellal, so some people call it with the name lemon eucalyptus. The difference in the content of this active ingredient produce a different distinctive aroma. However, in antiviral testing, both globulus and cidriodora have the same antiviral activity. Several products then developed by Balitro and BB pasca panen in the form of roll-on, inhaler, aromatic declays, aromatic diffuser, and aromatic balm, which containing combination of essential oil, especially globulus and cidriodora. This product had been launched by Minister of Agriculture and being licensed by PT Eagle Indopharma. The next stage of the research is in vitro study using SARS-CoV-2 viruses and preclinical testing, including toxicity inhalation that conducted at BB Veteriner. In vitro study showed that every essential oil, either Eucalyptus globulus or Cidriodora, could reduce the viral load and prevent the cytostatic effect appear in the cell culture. The toxicity test for inhalation on mice also didn't show any clinical, pathological, or histopathological changes. And then to evaluate the efficacy and effectiveness on human, the clinical testing were conducted in collaboration with Faculty of Medicine, Hasanuddin University. This clinical testing involved 50 COVID patients with mild and moderate symptoms. The results indicate that eucalyptus can reduce the clinical disease severity on COVID patients, such as anosmia, cough, sore throat, and also short breath. Eucalyptus could reduce the viral load indicated by the increasing of CT value. And then the negative proportion or CT value more than 40 of treated patients were higher and faster than the control group. Eucalyptus also can reduce the inflammatory by the parameter IL-6, increase the lymphocyte proliferation, and reduce the neutrophil lymphocyte ratio. Improvement also can be seen on the lung pattern of the moderate pneumonia patient. Now we're still conducting research in collaboration with IMERI, Faculty of Medicine, University of Indonesia, for toxicity and efficacy study of eucalyptus product as anti-SARS-CoV-2. Distinguished guests, ladies and gentlemen, as we know that eucalyptus is a large of family Myrtaceae, comprised of 900 species and subspecies. Eucalyptus is generally known for its woods, primarily used in making cellulose pulp and secondly for boards and panels. Some eucalyptus species are well known for their essential oil, that are extracted through steam or hydrodistillation. These have been widely used in perfumery and fragrance industry. And in fact, these are among the world's traded oil. Eucalyptus globulus and 𝒕𝒕𝒊𝒏𝒈 plantation actually are not available in Indonesia, so this essential oil must be imported. Eucalyptus commonly grown in Indonesia are from the Euphorella grandis and also Pelita species. Generally, these species are grown for the biomass, not for the essential oil. So in the future, we should collaborate to establish large eucalyptus plantation for commercial purposes, especially for the essential oil. We also possess the opportunity to substitute those oil from the local species, for example, 𝒊𝒎𝒂𝒏𝒔𝒎𝒊𝒂𝒏, to substitute the globulus, and also citronella to substitute the Eucalyptus 𝒕𝒕𝒊𝒏𝒈 due to their content with Cinyl 1,8 content at 𝒊𝒎𝒂𝒏𝒔𝒎𝒊𝒏, and also for the citronella content of Java citronella. Next. I hope that the Center for Forest Biotechnology and Tree Improvement Research and Development, which has the competence in producing seeds and superior varieties of forest plants, can develop Eucalyptus globulus and 𝒕𝒕𝒊𝒏𝒈 varieties that are able to adapt to our climate in Indonesia, and also can develop varieties of other species that high content of cineol or also in citronella to to have something different from the globulus and also for 𝒕𝒕𝒊𝒏𝒈. Utilization of biotechnology to produce rapid seed propagation for health and high quality seeds, and also easy to harvest with high leaf biomass production. I believe through strong and comprehensive research collaboration involving competent research institute and researchers to provide a scientific evidence base so that we can have a nation-pride product from the work of Indonesian people, from our natural resources to help overcome the COVID-19. I think that's all from me. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ibu Dr. Engineer Evi Savitri Iriani, for your presentation. I think it is a very interesting presentation about potential of spices, medical, and aromatic plants to help overcome COVID-19. Ladies and gentlemen, next presenter is Professor Dr. 𝒊𝒑𝒂𝒏𝒔𝒑𝒂𝒏, pharmacist. Professor 𝒊𝒑𝒂𝒏𝒔𝒑𝒂𝒏 is going to give a lecture with a topic of the process of drug discovery from forest resources. For Professor 𝒊𝒑𝒂𝒏𝒔𝒑𝒂𝒏, time is yours, and time for presentation is maximum 30 minutes.
Okay, thank you very much, Prof. Agung. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah, today we can meet in this very prestigious event. First of all, I would like to thanks to the committee for inviting me as one of the keynote speaker in this very prestigious event. And it is very honor for me to talk here. And in line with my background is a pharmacy, so I would like to talk about the process of drug discovery from forest resources. This is a general information or general talk about the drug discovery. Let me start my screen. Yeah. Yeah, ladies and gentlemen, as already mentioned by the previous lecture, Indonesia is very rich of biodiversity with the landscape, forest, and field that are varying greatly from region to region. And herbal medicine, which has been widely used in the past before pandemic outbreaks is taken into consideration as one of the treatment modality. So our people already often use herbal medicine for part of their life, for medication. And evidence were accumulated that foods and also herbal possess a potential antiviral ability against SARS-CoV-2 and can be used to prevent COVID-19, as also mentioned by Dr. Effie previously, that many herbal and many phytochemical compounds can be used to combat the COVID-19 virus. And forest and wild plant are undoubtedly good resources for develop new drugs with various pharmacological effects. Here we see in the illustration, this is a morphine, codeine. It is an opioid drug, which is nowadays used for painkiller or analgesic. It is also derived from a plant, Papaver somniferum or poppy plant. And many other drugs that also derive from plant, like atropine, reserpine, digoxin, and other, as we saw in the screen. We see in the screen, 𝒕𝒓𝒂𝒏𝒔𝒎𝒊, quinine, aspirin. This is the medication usually used nowadays. It is originally from plant. And so, beside the plants, the medication also can derive from animal or microorganism. Many antibiotics are derived from microorganisms like Streptomyces notatum, give penicillin and other antibiotic. And this is the very interesting example. While paclitaxel or Taxol, this is an anti-cancer drug, which is in injection form, but originally it derived from Pacific U3, and then in this bark, there is a compound, specific compound. Then finally, it is synthesized, in the pharmaceutical industry to give this compound. This is the example how the forest can provide many resources for drug discovery. And how about the herbal medicine for COVID-19? As already mentioned also by previous speaker, nowadays many people try to find the new drug from herbal to treat the COVID-19. And however, there is still a limited condition because still there is still a limited clinical trial conducted for herbal medicine for COVID-19. So usually the medicinal plant nowadays used as a dietary or complementary therapy to prevent infection and strengthen the immunity. And they also can be used for antiviral agent by coating in the mask like this. Usually we can use the aromatic oil to put on the mask, and then it can also prevent the infection or to protect us from the infection of SARS-CoV-2. And the herbal medicine, especially like aromatic oil, also can be used for disinfectant and also for sanitizing agent to disinfect the surface like this. This is the usage of the herbal medicine and its bioactive compound nowadays for COVID-19. But in fact, till now, the therapeutic guidelines still use the only very limited number of drug for antiviral like remdesivir or favipiravir. But so far there is no antiviral which is derived from herbal that can use for COVID-19 and also approved in therapy. But however, actually there are many foods and also herbs that reported to have antiviral and immunomodulatory activity. Some of them are reported to selectively stimulating cytokine, activating lymphocyte, increasing natural killer cells count, and also enhance the macrophage action. This is especially for non-specific immunomodulation or immune system. There are several like aloe vera, angelica gigas, astragalus, etc. And also there are some herbal or food that reported to have a effect on stimulating phagocytosis. Yeah, this is especially for the non-specific immune system, at least to protect in the first step of the infection of the SARS-CoV-2. But so far, this herb and food still used as a food and not yet discovered or not yet developed as a medicine. Actually, there are two major ways to discover a medicine from herbal drug. There are two branches. Yeah, the first is it is called mechanism-based research approach. It is usually used for developing drug from synthetic, and also in Indonesia, we mostly use this kind of approach. First of all, we should understand the mechanism of disease, for example, virus or COVID-19 disease, and then we screen from the several resources, and either from herbal or maybe from synthetic compound. After we find the promising result, then we can do in the computational in silico first, but then we can continue with the in vitro. As Bu Effie already mentioned in the previous lecture, she also did many in vitro study for screening the antiviral effect from certain or from various resources. And after the in vitro, so we can do the animal experiment or in vivo for toxicology and also pharmacokinetics. After we get the promising result from this step, we can continue with the clinical trial. The clinical trial consists of 3 clinical trials before marketing, phase 1, 2, and 3 trials. It is to evaluate the safety and pharmacology and efficacy in human. After we get the promising result from the third trial or the phase 3 clinical trial, we can submit the data to the authority body. Like in Indonesia, we have Badan POM. In America, there is FDA, and in every country have their own, to get the approval for the clinical application. After that, still we have to do such post-marketing surveillance for long-term use. Yeah, this is the first approach. But other approach is usually used in like in TCM or traditional Chinese medicine. They use efficacy-driven approach, where they start with the evaluation. So they start with the traditional use or empiric use, and then they evaluate the safety and efficacy in human first. So there is no screening in the beginning like this, but they start from human, because the TCM usually is used from ancient time, so they already use for a long time. Then they do the efficacy and safety in human. After that, they can start. They can also try with the in vitro in animal for possible chronic toxicity and surveillance of harmful effect. After the research or this phase, then they can apply for approval to the authority body, and then do post-marketing surveillance. Then after that, they can continue with identification of relevant substances and study the mechanism of action. So it is like a reverse. In the beginning, so they don't need to study the mechanism first, but it is already proven by the traditional or empirical use by the people. But after that, in the latter, they just study the mechanism of action for further improvement of efficacy. Yeah, this is the 2 way how to develop the drug, usually from herbal. But usually we use this kind of pattern. So first of all, we should do the in vitro or in vivo testing. This is from the basic, like Bu Evi already done with the in vitro and also screening with several plants. And actually we can do first with in silico. Usually if the chemical structure already known, so we can start with in silico because it is very, we can save the financial support because we don't need to prepare the animal or etc. So we can use the in silico first and then continue with in vitro and then in vivo. In vivo usually need for necessary for a toxicity study. And if they pass this step, so then they can do the human testing. Human testing takes about, usually it takes a long time to do the human testing because there are 3 phases and we have employed many subjects for this human testing. And then after that, after the data is reviewed by the authority body, so then they can get approval. And it is interesting that for only get the maybe 1, 2, 3 compounds, we have to start from the maybe 10,000 compounds first, and still preclinical maybe just past 250 and etc. Only to find 1 or 2 or 5 compounds to be accepted for clinical use. This is the illustration how to produce how the process of discovery. So if we use the resources either from plants, from forest, or maybe from other field, screening for the interferal activity. And it is I mentioned we can do first actually with the in silico assessment, but in this kind of study we usually have to know about the chemical structure of the active compound, so then we can mix it or we can process it with the target. This is, for example, this is a target of drug, and then this is the drug. So then we can see how it is matched or not, and then how is the possible interaction of the target and the drug. We can use the docking analysis. After that, we can choose which one is the most promising to be continued to a next step. And this is one we are doing in our faculty. We try to isolate the hesperidin from the citrus, and we do the extraction and then to get the product. And but for now we just target for the nutraceutical or jamu or food supplement, not yet for the medicine or the phytopharmaca, because in Indonesia actually we have 3 kind of or 3 categories of herbal medicine according to Badan POM, based on the quality, safety, and efficacy evaluation prior to registration to the Badan POM. So the first category is jamu. Jamu, this is the lowest category, and then the second is standardized Indonesian herbal. We call it in Indonesia obat herbal terstandar. And then the phytopharmaca or maybe phytomedicine. Phytomedicine or phytopharmaca, this is the highest level of herbal medicine. What is the definition? Jamu itself actually originated from Javanese word. I think very many Javanese know about jamu, but now it is used as a category of herbal medicine product, where the product have safety and efficacy data only based on inheritance or traditional and empirical approach. So there are no need to do a preclinical like in animal, and also for toxicity study. So the herbal medicine whose safety and efficacy only based on traditional or empirical, they can register as jamu. For example, like this. And the This is the logo of the jamu like this. Yeah, sorry, I forget to mention. Yeah, this is the logo of jamu like this, and this is the logo of obat herbal terstandar or standardized of Indonesian herbal medicine, and this is the logo of phytopharmaca atau phytomedicine. Yeah, so if the data or the safety and efficacy only based on the traditional or empiric use, so it can be registered as jamu like this. And maybe many people very familiar with this for men, yeah, man stamina, the pasak bumi. It is from forest in Kalimantan, from Erucoma longifolia, and then also kunir asem. It is very common in Java. And also, akar kuning, it is also famous from Kalimantan forest. Yeah, this is all are registered as jamu because the efficacy and safety is only based on empirical use or traditional use, and maybe not yet studied in preclinical. So, if we want to register as standardized herbal medicine, so they should support it. They should be supported by preclinical tests, including toxicity and pharmacodynamic study to prove the safety and efficacy. So it is will have such a logo. Yeah, they will register as standardized herbal medicine, and it should contain standardized extract. So they have marker or have a specific compound as a marker, like for example in temulawak, contain curcumin. Curcumin is a compound, a marker compound. This is important to make it standardized. So every production, every batch have the minimal or have the same amount of same concentration of chemical compound or active compound. Yeah, this is the standardized herbal medicine. This is this is no meaning at all. Yeah, just for show you the example. No endorse, yeah, at all. And then the phytopharmaca. Phytopharmaca is the highest level of herbal medicine in Indonesia, where the safety and efficacy has been proven by preclinical, of course, and also clinical study. So should be conducted a clinical trial to prove the efficacy and the safety. And it should contain standardized herbal component in single or combination, and has bioactive marker compound for standardization. Yeah, this is the highest level of herbal medicine in Indonesia. What is the implication? Yeah, the implication of the level or status of the herbal medicine is the acceptance by a clinician. Frankly speaking, is that jamu sometimes may be already accepted by wide population or our people, but it is very rare to be used or to be recommended by a clinician for treating certain disease. Yeah, because there is no evidence or there is no clinical data supporting the jamu. So even though they may be widely consumed by people, but it is very rare to be prescribed or to be recommended by clinician. But in the status of phytopharmaca or phytomedicine, it is expected that the clinician will trust the herbal product and then give the recommendation or give the drug and their prescription. Yeah, this is the way. This is the category of herbal product in Indonesia. As already previously explained by Ibu Evi about this is we are proud about this product, of course, but well should to go. I think there are still many steps if this product want to be accepted by clinician to use. Yeah, and of course Bu Evi already mentioned that this product already clinically tested, but later we will talk about a little bit about the clinical trial that should be done in Indonesia. Yeah. First, I will talk about the preclinical trial first. Preclinical trial for herbal medicine is important if the herbal product will be registered as standardized herbal, as I mentioned earlier. And this is to prove the effect on the certain pharmacological activity, and also to confirm the safety for human use. And the toxicity assay should be undergone according to duration of intended use. So if the herbal will be used for a long time, so the toxicity assay also should be done in the certain duration. Yeah. And the things that should be considered when we do preclinical trial for medicine is that, yeah, it can be conducted in vitro or in vivo, and it should use a valid method to confirm the activity. Yeah, it consists of study design, parameter of outcome, etc. Yeah, should be matched between the product and the parameter and the efficacy that will be measured. And use the appropriate animal model. Sometimes not all animal can be used appropriately or for certain pharmacological activity. So we should choose the appropriate animal for a certain study for preclinical trial. Yeah, this is, I mentioned earlier that the preclinical trial for safety, we use a toxicity study, and this is the duration should be used. This is correlate with the maximum duration of clinical trial. If the drug used for up to 2 weeks, so then recommended minimum duration of toxicity study should be like this. Yeah, this is one requirement to do the toxicity study. And from this toxicity study, we can then determine the maximum to recommended safe starting dose for initial clinical trial. So after the toxicity study, we know how toxic or how safe the product or the herbal. Then we can calculate what is the maximum recommended safe starting dose for initial clinical trial. Yeah, we should calculate first. Yeah, so then after we have the safe, from the toxicity, we can start the phase 1 clinical trial. And the phase study is governed by 3 principles: safety, ethical conduct, and efficiency. And patient safety is achieved by minimizing the number of participants exposed to serious or life-threatening adverse event. So usually we start start the clinical trial phase 1 with a minimum amount of subject to minimize the risk of participant against the serious or life-threatening adverse event. And we have to start with the specific dose, which already calculated from the toxicity study. So we should have a maximal tolerated dose and also pharmacokinetic and pharmacodynamic of the product. This is the primary goal of phase 1 study, to investigate the safety and tolerability of the product. And after the safety is established with the initial dose of the product, the dose then can be gradually increased and given more frequently. So for the first step, we should very careful to use the product, to do in the clinical trial. And how about the second? The second trial or second phase of trial is we use the participant with the specific disease. It is intended disease, so the targeted disease, and determine whether it is still effective or not for progressing to phase 3 trials. Usually we have different doses, to optimize the dose with we have a varying doses and varying period of time to obtain the therapeutic benefit with the optimal dosage. And the fact is that many drugs sometimes drop at each phase of clinical trial process. So then maybe it is not benefit, or maybe it's lack of efficacy, so then we cannot continue to the next step. So many as I mentioned earlier, that only for getting maybe one drug, we should try with many kind of drug, to get the good or the best medicine that can be accepted. Sometimes phase 2 and phase 3 can be combined into a single trial. And it is now often used in a pandemic era, because we need acceleration of the process for drug discovery. So then we can make an overlapping from the second second phase trial. Then without finishing the second trial, but the promising result, we can continue the third trial. The first 3 trial usually use a larger number of patients and treat with one optimal dose, which is obtained from the phase 2 trial. And the goal of the phase 3 trial is to confirm the efficacy. And usually we compare it with the standard care for the respective indication. For example, if we want to find the antiviral activity or antiviral drug from herbal, then we will compare it with, for example, oseltamivir or maybe favipiravir. This is the standard care used in the COVID-19. So then if we want to confirm that this is also have a benefit for antiviral, so then we can compare it with the standard care. And we in the phase 3 trial, we usually need 1,000 subjects to confirm the result before the registration. And the registration of product usually done after we get the positive result from the phase 3 clinical trial. And this is the general rule of conducting clinical trial in Indonesia. The clinical trial should be conducted according to good clinical practice or GCP, and the protocol should be approved by ethical committee for ethical clearance. And if the product will be registered for marketing, so the protocol should be approved by authority body for drug regulation, like Badan POM. So I have 2 or 3 clinical trial now is ongoing. So we still waiting for the approval from Badan POM for doing this clinical trial. And the trial is better to be registered in clinical trial registry. This is just an example, the certificate of good clinical practice training. Every researcher that will do clinical trial should have the certificate. And researcher should possess a GCP certificate. And the clinical trial protocol, it is very strict. There is a rule that it contain general statement of purpose, complete the clinical result on animal study, and clinical data if available, time frame, and of course the primary and secondary objective. It should be mentioned in the protocol, and the type of study. Type of study is very, there are many type of study that can be used, like is it a double blind or single blind with placebo or not, and etc. So we should choose which is the more appropriate for our study. And it is also will affect the power of study. If we use only without placebo, without comparison with control, so the power of study usually is less. But if we want to increase the power of study, we have to use the appropriate method, like randomized clinical trial, double blind, blah blah blah. And also the recruitment criteria we should mention in the protocol. How about the randomization, sample size, intervention, and duration of study, how to stop the study, and etc. It is very complicated actually to do the clinical trial, especially if we want to have approval and the drug will be registered as a phytopharmaca or phytomedicine in Badan POM or other authority body. So we should comply with very strict regulation for the clinical trial protocol. And this is our summary that actually if we want to develop a medicine how is the process from the garden or from the forest to clinical practice? Yeah, we can start from ethnomedicine, for example, from the traditional medicine, and from that we can directly, or maybe we can try to isolate the active compound. It is like Paxol, or maybe I previously mentioned some chemical compound or some medication, some medicinal is also derived from ethnomedicine or from plant, and they isolate the active compound. Then after the chemical structure is learned, the pharmaceutical industry then synthesize in the synthetic compound. Yeah. If we through this pathway, so we can have the standardization of herbal medicine product and standardization of extraction, we can get the jamu formula. If only jamu formula, we can also use this. But if we want to increase the level of the herbal medicine, we can do a preclinical study to have the standardized herbal medicine. But in other way, we can do such jamu scientification. This is a specific way in Kementerian Kesehatan, but maybe not all, not many to do. In BPOT in Tawangmangu, yeah, there is a jamu scientification, so we can get the scientific based jamu. And if we want to get the phytopharmaca of our herbal, so we have to do the phase 1, phase 2, and phase 3 clinical trial. So there is several ways how the herbal can be used for clinical practice. But again, to be accepted by clinician and then used clinically, so usually doctor or clinician need more evidence, so they will trust for phytopharmaca than to herbal only jamu or standardized herbal medicine. Okay, I'm come to my end of presentation. Yeah, forests provide a good sources for drug discovery and development, and the product can be formed as a new compound or new chemical entity. We can isolate and make in a synthetic compound, or register as jamu, standardized herbal, or phytopharmaca, which is usually not the isolated one, but still mixed. Yeah, several compound can be mixed together for becoming the drug formula. And what I want to remind is that the claim of herbal products should be based on appropriate trial, either preclinical or clinical, and shouldn't be only based on testimony. And we should support the discovery of medicine from plant or from forest with appropriate method in order to be accepted in clinical use. Okay, this is what I can share to you today. Thank you very much for your attention, and I will back to Pak Moderator for the screen. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Professor Dr. Zulis Ikawati, pharmacist, for very clear, I think, presentation. It opened our insight, yeah, about the process of drug discovery from forest resources. Professor Zulis explained the detail of the processes, how to preclinical and clinical trials for herbal medicines to provide some data, yeah, for example, efficacy, safety, standardization to get a registration number from National Agency of Drug and Food Control of Indonesia. Ladies and gentlemen, now we continue to next speaker. Please welcome our next keynote speaker, Dr. 𝒕𝒓𝒂𝒏𝒔𝒕. He is Director General of CIFOR. He is going to speak about the economic impact of the COVID-19 pandemic. Dear Dr. 𝒕𝒓𝒂𝒏𝒔𝒕, time is yours, and time for presentation at maximum 30 minutes.
Thank you, Professor Nugroho, and I think we are going to discuss about something very different after the fascinating presentation we had so far. And I've been asked by the organizer to present something about the economic impact of COVID, which is something that is clearly a of great importance. And I will try to share my screen and start my presentation. Now, I hope you can see my screen.
Okay, we can see your slide very clearly.
Okay. Thank you. So the economic impact of the COVID pandemic. So we are going a little bit to look at the outline about the global impact, look at the macroeconomy and the forest and forestry sector, and then we will have a focus on Indonesia because that's our main interest here in INAFOR. Again, macroeconomy, household and forestry sector. So the COVID pandemic by numbers, and this is a screenshot of the Johns Hopkins University dashboard. I mean, you can see this is a huge social and human impact. I mean, sort of that should not be minimized. I mean, this is one of the biggest pandemic that we have seen after the one on the avian influenza or the Spanish influenza in the beginning of the last centuries. So it's a huge cost, human and social, and it has impacted the lives of many people, everyone, I believe, and the way we work. But what we are going to discuss more specifically today is the issue of economics. So what were the economic impact of the pandemic on the global economy? If you look at the global GDP growth in 2020, you see that in fact all the countries has a negative one, and the Sub-Saharan Africa, emerging Asia, you can see excluding China, had a 8% in fact decrease in the global GDP, and you can see on the graph on the right side that there has been a very strong dip, but at the same time you can see now a recovery, but you can see that the recovery is parallel to the curve that should have been where there is no pandemic. So we are recovering relatively fast, but we are not recovering to the level that would have been attained prior to the pandemic. And there has been an impact, of course, on the trade and goods and services, and you can see the impact. The blue curve is the global financial crisis that you all remember in 2008, and the pandemic. So there is a big rebound in terms of trade, but there has been a big dip in it. So there has been a huge shock in the macroeconomic sector, in the trade, but things seems to recover relatively fast, but not to the level where they should have been without the pandemic. And if you look at the sector, I mean, you can see that the sector that have been very much impacted are services and goods, and differ for the countries. And you can see, for example, how the import of has been service in Canada or the United Kingdom. So you can see that the crisis has been quite uneven in the effect that in the country, and it depends very much, in fact, on how long, how effective the mitigation measures were put in place by the country, and how soon they were entering into the pandemic, and how quick they were managing to get out of it. But we are still struggling with a large unemployment, and you can see the level of unemployment between 2019 in red and 2020, and you can see that for many of the developed countries, there is a very strong rise of unemployment, which is also linked to many other places and the increasing number of poor people. I mean, sort of, we have something like 150 million people that are now in the category of extreme poor that were not in 2019. So the COVID-19 pandemic brought us back something like 20 years back in terms of poverty and unemployment. But there has been a very strong fiscal reaction by the government, and you can see that the number can be quite mind-boggling. So there has been a huge injection of cash or financial incentive in the economy, in the industry, to help mitigate the impact of the crisis, which is probably the reason why the recovery has been so quick. But unfortunately, it is not necessarily the same all over the place, and it has not necessarily reached all the people that were supposed to be reached, and including the category of the extreme poor, which were always or very often missed by this financial incentive that have generally benefited a larger corporation and people more in the middle class category. And if we look at the recovery, and that's something that prepared by the OECD, and you see that a country like China expects to have recovered by mid-2020, where a country like Argentina expect to recover something like post-2025. And if we look at Indonesia, we expect a recovery at the end of 2021. And it seems that it's quite on track. There has been a significant growth, but we'll see in the Indonesian part. And really, I mean, a sort of the problem is, and it's something that's been written by the IMF and McKinsey, I mean, the outlook of this recovery, it's significant but uneven, and also is subject to upside and downside risks. So we don't know yet what will be the impact of the Delta variant or the new Mu variant that has been discovered recently. So recovery is on the way, but it's still very fragile and still very possibly affected by events that we can discuss now or we can forecast now. So it's very important to continue the push for vaccination because it seems to be the best protection so far. So what about the forestry sector, which is the one that is of interest for me as a forester and for INAFOR? There was clearly a very strong initial shock, and you can see in this paper that was produced about the impact of infectious disease on firm performance. And these are firms that are listed in the stock market, so they don't necessarily represent all the forestry things, but they represent quite a number of forestry firms, a couple of hundred. And you can see that all the regions have been affected in terms of the trade and the production. You can see that forestry has been affected more. I mean, let's read forestry as a timber and wood than the pulp and paper sector. And you can see that Asia has been affected somewhere in the middle if you compare to North America or Europe. So there has been a very strong initial shock on the forestry sector linked to the various lockdowns, to the various disruption of supply chain. But ultimately, I mean, this shock was quickly absorbed. And the prior COVID trend in terms of the forestry sector remain unchanged. So the comparative conclusion, which is comparison that COVID-19 did not decisively change country respective pre-existing trends. And for three of the most important forest countries, I mean, we still see, we had before COVID an accelerating deforestation in Brazil. It continues post-COVID. We had a continuously high deforestation in Mexico, and it's still the same. And we had a decelerating forest loss in Indonesia before COVID, and it continues the same after COVID. So in terms of the global forestry sector, we don't consider that COVID have a very long-term impact at this stage. It was a very important shock. It has probably impacted differently small enterprise and big enterprise and the life of the people, but not really the big macroeconomic trend of the forest and forestry sector at the global level. Now, if we look at Indonesia, and if you look at the GDP and the macroeconomic indicator, you can see on the various graphs that there was a drop in the GDP in 2020, and you have the detail here, and you can see by quarters what was the impact, and it is decreasing. But there is a good recovery, as we say, in in 2021, unfortunately, not at the level where we should have been without the drop on 2020, because if you look at the increasing GDP, I mean, we should probably be at this level and not at that level at this stage. So good recovery in Indonesia after a very strong initial shock, but not yet at the level where we were expected before the pandemic. But if you look at some other macroeconomic things, you can see that, as we saw at the global stage, unemployment has been strongly affected by the COVID crisis. And we had before some sort of a steady, slow decline in unemployment rate. And then suddenly in 2020, there has been a big jump. We are seeing an improvement, but we are still much higher than in 2016. So this is an important issue in terms of unemployment and in terms of the social texture of the society. And if you look at a specific sector that is not the forestry but tourism, then you see that has been a terrible shock. I mean, sort of, if you compare between January 2020 and what is happening now. So the tourism sector has seen a drop that is in the region of 90% or even more. And an area like Bali have really received the shock fully fronted, and they will likely take a long time to recover from this crisis. If we look at the export of Indonesia in terms of product and country, you can see that, and this circle is represent the wood and wood forest product, which is about 2.3% of the export of Indonesia. You can see that, sorry, I have to go back one slide. It has not been too much affected by the COVID-19. This is a 2020 figure, and in fact, the 2019 figure is very similar. And similarly, the countries that are the main country importing goods from Indonesia are about, when you have China, Japan, Singapore, India, and the United States, it's about 50% of the export of Indonesia. And so doesn't seem to have a huge impact on the export in general. And at the same time, as we said, I mean, although some people were saying beginning of the mid-year 2020, there were some alarming reports saying, oh, there has been a spike in deforestation in many tropical countries, including in Indonesia. When you look at the global data produced by, in this case, by Global Forest Watch, but the data of KLAK are the same, you can see that, in fact, COVID-19 has not affected deforestation, and that deforestation is slowly decreasing. And it was the case from 2017, 18, 19, and 2020 follow the trend. So there hasn't been any spike in deforestation linked to COVID-19. So this is a good news, and this shows very favorably Indonesia in the world stage, because this is one of the only tropical countries where, in fact, deforestation has decreased in 2020. But what about the forestry sector export? I mean, so if you accept the last bar of the picture, which is 2019, but it's only for half the year, you can see that the forest sector export and different type of product in 2020 were very similar to the level in 2019 and pretty much in the average of the last 4 or 5 years. So there hasn't been any impact really on forest sector export of the COVID-19. If you add this, the fact that the forest sector has been competitive and performing well, to the fact that deforestation has decreased, we can consider that the management of Indonesia forest sector, I think by the relevant ministry, has been doing a very good job in terms of sailing through the crisis. Now, if we look at the specific products, and you can see the same trend. I mean, a sort of, this is for wood and wood products. This is for pulp, paper and paper product, and you can even see that the furniture export is growing. So overall, by sector, it's confirmed the good performance of the forestry sector, and at the same time, quite being like, how can I say, isolated from the crisis. However, if we look in detail on micro and small manufacturing industry, and you can see that the small, very small enterprise have been hit very hard in terms of the capacity to produce in 2019. They are recovering, but they have been hit very hard. And the problem is that these small enterprise, they don't necessarily have the financial capacity to survive through a crisis. I mean, a sort of, and as a result, it is very likely that there will be a number of these enterprise that will not recover and that will not survive COVID-19. So what are the net outcomes for forestry and forest resource in Indonesia? I mean, we can say that the pandemic had no clear, long-lasting impact on the forest economy and the forest estate. Sector exportation have not declined, at the contrary, and deforestation has declined. There was an immediate and short-term drop in the first half of 2020, but we are largely recovered to pre-COVID level, which is not the case of the world economy. There will probably be some more lasting impact on micro-enterprise. However, the rebound is very much linked to the demand, and we have seen the demand is coming from 5 main countries. And in these 5 main countries, I mean, there are some in the midst of a new wave of COVID. Hence, if the demand decreases, the rebound can be vulnerable to this demand decrease, and then that could put into jeopardy the good performance that we have seen in 2020 and the first half of 2021. And you can see also that climate change and commodity price are likely going to have a much more pronounced impact on the forest and COVID. The presence or absence of mega fire or the price of commodity like palm oil or soybean or rubber have a very much bigger impact on the forest instead and the forest sector than as COVID, which is not true for several other sectors like we have seen tourism. So pretty good picture for the economic impact and of the forest sector in Indonesia, and good performance by the people that are managing it, KLHK and the other ministry. And I think that now we have to see if the demand continue in the importing countries, how we can continue this good performance and these positive trends. Thank you very much.
Okay, thank you very much, Dr. Robert Nasi, for the interesting and great presentation. You already explained us about the economic impact of the COVID-19 pandemic. That's very interesting. And ladies and gentlemen, now I would like to open a Q&A session for maybe 30 minutes. If you have questions, please write in. If you write in chat column, okay? Yeah, I would like to check at the chat column, ladies and gentlemen. Yeah, there are already many questions. I would like to mention one by one. Yeah, also subjected to specific or all keynote speakers. Yeah. Okay, the first question is from Mr. Yayan Hadi. The question is subjected to Dr. Engineer 𝒉𝒂𝒏𝒔𝒕 and also Professor Dr. Julis Ikawati, pharmacist. Mr. Yayan Hadi said that Dr. Evi mentioned about 50 plants have potential as antiviral, while Professor Julis reported that forest and wild plants were good resources for develop new drug. In terms of integrated research, BRIN era, Do you agree if INAFOR 2021 decision can be assumed as a kick-off meeting for new collaboration among us? Could you please share your opinion how to start the collaboration pentahelix multi-stakeholders principle as Professor Ali Gufron mentioned before? Thank you very much. And maybe one by one, how to say question and how to say speaker can explain or answer the question. Okay, firstly, I would like to Dr. 𝒕𝒓𝒂𝒏𝒔𝒕 to how to say answer the question. And next, Professor Julius. Time is yours.
Okay, thank you, Mr. Chairman, and thank you to Mr. Yayan. I think by your statement, I couldn't agree more, because by attend this the 6th INAFOR conference, especially the STRIP 5, we can meet a lot of participants from many different institutions that we can collaborate. We can initiate the collaboration among us to conduct research, especially in utilization of medicinal forest plants. We have the Center for Biotechnology and Tree Improvement, Research and Development, and also from my institution, 𝒊𝒐𝒏𝒂𝒏, for preliminary bioprospecting and domestication of the plants. We also have the pharmacy and medicinal faculty to develop and testing the potential plants. And also we have the government from the BPJS to support this product. I hope that in this conference also attended by the industry for commercialization of the product. And I pray that by this date we can as the kickoff of the more more collaboration between us, the stakeholders for this research and development of the medicinal forest plants. I think that's all for me.
Okay, please, Professor Julius, to explain.
Yeah, thank you, Prof. Agung, and I cannot agree more with Bu Evi said. Yeah, so I think after this meeting we can start the communication. Yeah, start to communicate each other. I'm from Faculty of Pharmacy. Prof. Agung from Faculty of Pharmacy UGM. Open our faculty very we can do many collaboration research together. So yeah, I think it is very good time to collaborate.
Okay, okay, enough, Mr. Yayan Hadi. I think. Next question from Mrs. Dona Octavia. Since we know several plants contain cineol that has a beneficial effect for antivirus, for example, kaju putih, eucalyptus, and also cardamom. Regarding this condition, aren't there some factors that give significant influence or impact to increase the content of cineol in the plants? I think a question is subjected to Professor Julius Ikawati. Yeah.
Yeah, thank you for the question, Prof. Agung, dan for Mrs. Dona Octavia. Yeah, in fact, there are many factors that can influence the content of the chemical constituent of the plants. Yeah, for example, from the soil and the content of the height, the plantation, etc. So I think maybe agriculture person maybe can give explanation more detail. Yeah, but in fact there are many conditions, because different region also can influence the content or the either the concentration or maybe the variation of the content of the plant. So I think it is we should learn for every plant what influence the chemical constituent. Yeah.
Okay, enough, Professor Julius. Okay, I continue to next question from Mr. Adisurya. Yeah, the question is subjected to Dr. 𝐸𝐻𝐻. Economically, which more effective to finish or end the plagues? Yeah, full lockdown or partial lockdown? Yeah. Okay, Dr. 𝐸𝐻𝐻, time is yours.
Well, that's a difficult question. I mean, if you look at the decision that were taken by our various leaders in the world, I mean, that more like looking through the crystal ball than having. So I don't think that there is a proper answer to that. What you see now is that it seems that the lockdown, really a full lockdown, had an effect in the first stage of the pandemics, like active policy that were implemented in China had a very strong impact in terms of blocking it. Then you saw the emergence of the variant, and then suddenly the whole idea of eradicating the virus through lockdown seems to be not possible anymore. And you see now that China has new case. Countries that had almost no case, like New Zealand and Australia, are now moving into lockdown. And countries like Singapore say that finally we are not going to be able to eradicate the virus. What we need to do is to live with it. That means that we need to vaccinate a very high percentage of the population, and we need to live with COVID as an endemic level. A bit like the flu. So every year people will get their COVID jab like they get their flu jab. So the jury is still open. But you see now the main variant is the Delta variant, and you have seen in many countries the impact and the increasing number of cases, even with the vaccinated people. What you see also clearly is that people are registered as positive case, but they are not sick in the ICU as much as they would if they were not been vaccinated. So for me, I don't think it's a matter of lockdown. It's a matter of increasing the number of people vaccinated and giving booster shot for people that need booster shot, and then keep on the sort of social distancing and as long as they are necessary. Thank you.
Okay, thank you very much. Very interesting explanation from Dr. 𝐸𝐻𝐻. Yeah, the most important thing, I think, how to say, do social and physical distancing, yeah, rather than full lockdown or partial lockdown. Okay. Next question from Mr. Dimas Bagus. Yeah, the question is subjected to Dr. 𝐸𝐻𝐻 again. Yeah. How do you think, Dr. 𝐸𝐻𝐻, to strike a balance between economy and health in the mid of COVID-19? Yeah.
Well, I think that they are not independent. In fact, if a large part of your population or your let's say priority worker, like a health worker or food is sick, I mean, then it has a huge impact on the economy as a whole. On the other side, for a country like Indonesia, where there is a large part of the economy that is informal, it is very difficult for the people that is selling the mie ayam in my housing complex to say, I stay at home and I don't work today. Because if he doesn't work today, I mean, he doesn't eat tomorrow. So that there is a very delicate balance to see, I mean, a sort of to which extent the policy decision really solve the health issue, but create an economic crisis, or to which extent the favoring the economy creates such a health issue, then it becomes an economic crisis also. But it's a very delicate balance, and I think so far, I mean, Indonesia has not done too bad on that. Some countries have done better, but they may be also a bit easier to manage, and you cannot compare Singapore and the whole archipelago of Indonesia. Some countries are not doing as well, but overall it's very much a very fine exercise of walking a rope under a big cliff.
Okay, ladies and gentlemen. Okay, next question from Dr. Bogiraya Latwamuthi. Yeah, question is subjected to all presenters. Yeah, the question: Indonesia's tropical forests are the lung of the world, where a certain amount of biodiversity resides in the forest. How does the degradation rate of Indonesia tropical forests affect the supply of medicinal plants in the pharmaceutical sector? Is there any scarcity of resources, raw materials obtained from Indonesia tropical forests in supplying pharmaceutical products? What if the tropic forest as the lungs of the world went extinct? How did mitigation and adaptation efforts to prevent the extinctions? Thank you. Yeah, the question subjected to all presenters. I think, yeah, it is one by one. Yeah. Firstly, please, Dr. 𝒉𝒂𝒏𝒒.
Okay, thank you, Dr. Bokriana. You asked about, is there a scarcity of resource raw material obtained from Indonesia tropical forest for supplying pharmaceutical product? I think, as you know, that most of the medicinal forest plant is not cultivated yet. So to provide the raw material for the industry, it must be there is scarcity. So first, before we utilize the plants, we must first domesticate it first by cultivating at the optimum condition to produce the high yield and also high bioactive compound to provide the industry. And what if the tropic forest as the lung of the world when extinct? It's depend on us. Is there we care about the forest? Is there any deforestation also happen all the time? So I think forests must be protected as the lung of our world, but we can conduct the agroforestry. So the farmers near the forest can get some income from the forest without cutting the tree. I think this approach can help us to protect our forests. I think that's all.
Okay, thank you very much. Yeah, maybe Professor Julis Ikawati have another opinion.
Okay, thank you, Prof. Agung. I would like to add the answer from Bu Evi. I agree with Bu Evi. We need to maybe cultivate or domesticate the plant from the forest. But I'm more afraid that the deforestation is due to the building or something else than the industrial for a pharmaceutical industry, because actually for the drug development from the forest, I think in fact we can from the experience using some medication that already derived from forest, the pharmaceutical industry learn the chemical structure and then synthesize, and then we have a chemical compound, a synthetic compound. So for this is to avoid the extinction of the forest, I think. So in fact, the challenge of exploring the forest for the drug development is the sustainability. We have to keep the sustainability. So one way is to cultivate, but the other way is not only explore from directly from the plant, but we can make the synthetic compound. That's the synthetic compound, then we can use for the medicine. So it can prevent the deforestation due to the drug development. Yeah, but again, I'm more afraid to see that the deforestation is due to the like mining or building, etc. So that's all. Thank you, Pak Agung.
Okay, thank you very much, Professor Julius. Do you have another opinion, Dr. 𝒕𝒂𝒏𝒔𝒕?
No, I mean, so that clearly, I mean, there is no deforestation at any large scale that is happening because of medicinal or product. What is happening in a very few cases, and then when you have a very powerful and very successful medicine developed from a forest product, and then it's cheaper to collect the product in the wild than to domesticate it. Then there may be an overexploitation, and that's the case of in Africa, the Prunus africana, where from the bark you derive a very potent drug against prostate cancer, and there has been a huge impact on the population of Prunus africana, but not something that you can call deforestation. And the main cause of deforestation in Indonesia has been agriculture, small and large scale agriculture, a little bit infrastructure, mining also, but that the main cause is really about agriculture, small and large, and the wildfire. So these are the main cause, and they may create a problem because then the resource in medicinal plant may decrease, but it's not the medicinal plant collection that create the problem. Now, if the tropical forest should disappear, then we will have a much larger problem, and it's not only because they are harvesting a lot of the biodiversity, because they produce goods and services in the ASEAN region. The forestry sector represents something like $18 billion per year of industry for wood and forest product, and an even bigger share of, I think, in terms of ecosystem services like pollination, mangrove protecting against tsunami, peatland and mangrove, and then storing carbon. So there will be a huge impact in terms of climate change, in terms of ecosystem services, and in terms of good and food security if the tropical forest should disappear. But I hope that now that something that is not going to happen, because there is more and more realization by the various managers and government that the importance of tropical forest. And if you look at Indonesia, the permanent moratorium on about 66 million hectares of primary forest and peatland shows that the government is acute of the need to maintain these resources as much as possible.
Okay. Yeah, we continue to next question, ladies and gentlemen, from Mr. Adi Nugroho. Yeah, I'm very interested to all presentation, but in my dissertation, I found that industries of herbal medicine earn more highest income for herbal drugs. Unfortunately, stakeholders such as farmers get very low and only use herbal as adding income. I think this condition needs to repair. Yeah, I think the question is subjected to all presenters. Maybe, yeah, anyone presenter can explain the question. Dr. Evi Savitri, Professor Julius, or Dr. 𝒕𝒂𝒏𝒔𝒕? Maybe Professor Julius?
Yeah, sometimes happen like this. So I think just of course we have to arrange about the sharing from the farmer and the pharmaceutical industry, something like that. So the regulation maybe should be made for give the more beneficial for the farmer, or to get more income, something like that, Pak Agung. I'm not very familiar with this because this is a more regulation. I think not very. We need with the regulation and kebijakan
Yeah.
policy.
Yeah. Okay. Maybe Dr. 𝐵𝒍𝒂𝒏𝒔𝒕 have another opinion.
Okay. Thank you. I think the government must implement the inti-plasma approach for this condition. So the farmers are the plasma, and the industry will be the inti. The industry should buy the raw material from the farmers with the the contract price, so the farmer can get enough income from this contract. I think this approach can implement for reduce the the different gap between the industry and the farmers' income.
Okay, thank you very much, Ibu Dr. 𝐵𝒍𝒂𝒏𝒔𝒕. We still have time, I think, for a question and answer session. I would like to continue. It is a very interesting question, yeah. It is subjected to Professor Julis Ikawati, yeah, with Bu Zulis. Yeah, a question to Professor Julis. Jamu may contains thousands of compounds. Is there a quicker way to find the respective active compound in jamu? Yeah, maybe how to identify the active compound in herbal medicine. Yeah.
Okay, thank you for the difficult question. Yeah, so when we identify the active compound from the jamu, of course, we have to do several steps. First, we have a fractionation. So from the fraction, then we can find is it any effective or not. Yeah, the effect of the fraction. If there is no effect on this fraction, so usually we have several solvent for fractionation, like polar or non-polar fraction. After that, if there is no effect on certain fraction, so mean that there is no active compound on that. So we will do with the most active fraction. Yeah, for example, from either alcohol or other solvent. And after we find the positive or result from the certain fraction, then we can do the next fractionation and then isolate the isolation of the active compound. Yeah, maybe something like that. Yeah, but yeah, it takes time. So I don't know quicker way, because it needs a step. Yeah, and we should follow the step to find the bioactive compound, something like that.
Okay. Yeah, one question is okay. Ladies and gentlemen. Yeah, the question is subjected to all presenter, but I think Professor Julis can explain more detail. Yeah, in the early of pandemic, we heard that the drug of malaria, can be used to treat the patient that suffer from COVID-19. Yeah, is there any study or research about it? Yeah, I think it is last question for speakers. Yeah, and Bu Zulis, I think have how to say, wide insight about anti-malaria drug.
Okay, yeah, very interesting that in the early of pandemic, we often hear about hydroxychloroquine. Hydroxychloroquine and chloroquine is anti-malaria, but at that time, first originate from the China. The experience in China, they used this kind of medicine for treating the COVID. But after several clinical trial, and also the clinical trial is also coordinated by WHO with the name is there is a trial, a big trial in around the world, but the result is that the anti-malaria, the hydroxychloroquine and also chloroquine have no benefit effect on the treating of COVID-19. So nowadays this drug is discontinued to be used in COVID-19 treatment. So we don't use this drug anymore today. Yeah.
Okay, thank you very much, Professor Julis Ikawati. Ladies and gentlemen, actually there are still many questions, in chat column, but the time is over. We can discuss again in next occasion, And ladies and gentlemen, this is the end of our session. Soon after we close the session, and there will be photo session, so please turn on your video and give your best pose. Smile everyone, and next the committee will give certificate of appreciation to the keynote speakers. Ladies and gentlemen, please give big round of applause for Professor Julis Ikawati, pharmacist, Dr. Engineer 𝒕𝒓𝒂𝒏𝒔𝒕 and Dr. 𝒕𝒂𝒏𝒂𝒏. Okay, thank you very much, Professor Dr. Ali Gufron Mukti, PhD, Professor Dr. Julis Ikawati, pharmacist, Dr. 𝒕𝒂𝒏𝒂𝒏, Dr. Engineer 𝒕𝒓𝒂𝒏𝒂𝒏 for the great and a very important lecture. I hope we can meet again in the future conference. To all participants, I would like to inform you that after this session, you may continue to the next presentation or lecture after taking a break 30 minutes. I hope you enjoy the conference to the end. Thank you and see you again. And I return back opportunity to the MC, Dr. Istiana. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon.
Thank you, Professor Agung Indro Nugroho, for leading the interesting discussion. And ladies and gentlemen, the second program will commence after a break. So we will come back about 12:30 today. But before that, we will have another photo session. So we will have around 11 or 10 screen. We will have another photo session. Is that right? Yeah. Okay, we'll start with screen number 1. And please turn on the camera and be ready for your picture to be taken on the screen. Screen number 1, on the count of 3, 1, 2, 3. Screen number 2, 1, 2, 3. And screen number 3, 1, 2, 3. Screen number 4, 1, 2, 3. And screen number 5, 1, 2, 3. And the next screen, number 6, 1, 2, 3. Screen number 7, 1, 2, 3. Screen number 8, 1, 2, 3. And screen number 9, 1, 2, 3. And this is the last screen, 1, 2, 3. Thank you, everyone. And it is time for us to announce the winner of giveaway prize for participants. In this category, we will have 3 giveaway for participants with most interesting, motivating, or most attractive question. I already got the name of 3 winners for this session. The winner are Mr. Adi Surya, and Dr. Bukiraya Larwamuri, and Mrs. Donna Octavia. Congratulations for all of the winners. The organizing committee will contact you after the conference finished today. And before we start the next program at 12:30, the organizing committee will have a video to you to enjoy. So please come back at 12:30 as we will have another interesting discussion and another giveaway, and we also will throw the giveaway to lucky participant. Thank you. Assalamualaikum warahmatullahi wabarakatuh.